Okay, good afternoon. I'm taking my mask off because the purpose of this is to communicate with the public. We are observing social distancing and we do wear masks in this building, but when we're trying to communicate with folks in the community, I think it's okay to speak directly to them. So, since March 16th, Lewis County has performed over 12,000 COVID tests, which is quite remarkable. We've tested 7,000 unique individuals, which means that about a third of our community total has been COVID tested since the start of the pandemic, which I think is pretty darn good. So kudos to our staff and to the community. Of those 12,000 tests, we have had 78 positive tests total since March. Unfortunately, 7 of those positive tests have come within the last 24 hours. 6 of those positive tests are from the same cluster stemming from a religious gathering in Croghan last weekend. So far, we've tested 15 folks from that gathering who have symptoms. 6 have tested positive, 9 are awaiting results. 72 people in our community have been identified as contacts and quarantined due to this cluster. The religious gathering was at the Apostolic Christian Church on 812 in Croghan. Lewis County has done extremely well in this pandemic so far. We have some definite structural advantages that keep us safe in Lewis County. We have a low population density. We have a few amount of people over many, 1,200 square miles. We have a low reliance on public transportation, which means a lot of people aren't getting on buses and subways together. That keeps us safer. We have a low number of congregate living scenarios, like colleges, and we only have a couple assisted living facilities in the community. And we're relatively isolated. We don't, Lewis County is definitely not a major thoroughfare for transportation or people traveling. However, I think the point of what we want to talk about today is that structural advantages are not going to be enough to continue to keep us safe going into the fall and especially into the winter. The fact of the matter is the prevalence of COVID-19 continues to expand throughout the United States. We are going to be at risk when we do not do certain very simple things. If we gather in any setting without masks, we're going to be putting the community at risk. When we gather and we fail to observe social distancing and we fail to enforce limits on building capacity, we are going to have problems with the virus. When we disregard travel restrictions that the state has put into place, New York State continues to do well. Lewis County continues to do well, but we know there are parts of the country that are not doing well. And the state has made very clear every day which parts of the country folks are supposed to quarantine when they come from those places. And when we fail to enforce those, and when we disregard those travel restrictions, we're inviting the virus to come into our community from other places that have not fared as well as we have. If you think it can't happen here, I guess what we want to say to you today is that it can. 2 examples that I think are relevant. Right now, Steuben County and Chemung County are considered hot spots by the state. That means that their schools are closing, their businesses are closing. And look at those counties. Look at Steuben County, look at Chemung County. What is so different from Corning and Lowville? What's so different from Bath, New York and Croghan? They're not very different. They're not, on a main thoroughfare. They're very rural places. But the fact of the matter is, those places are now forced to close their schools, and they're forced to close their businesses. I think that's exactly what we want to avoid in Lewis County. We've done so well so far, and we need to continue to do well. The last thing I want to talk about is COVID fatigue. We've been at this for 8 months. I'm tired of it. I think that we all are at the point where we're sick of masks, we're sick of not being able to get together with our friends. I'm as guilty as anybody as getting a little lax and maybe going to some events and some things that we shouldn't be going to. But the fact of the matter is we all need to strap back in. The winter months are coming, and we know that when more people are inside, because we can't all be outside in the winter, and we have more gatherings under one roof, we're going to have problems. So with that, we're going to talk a little bit about community spread and what that means. Ashley will walk us through a graphic that we have here, and then we'll turn it over to Jerry, care of the hospital. Health system, excuse me.
So we wanted to just highlight here an example from Onondaga County with just how much one person that's infected going to a large gathering, how much impact that can have in the community and how it can spread. So we have our original case here, who is the first case, attended a graduation party and spread it to all of these individuals. Now, this is the importance of contact tracing for public health. We know we have a positive case, so now we want to know everybody that they've been in contact with so we can quarantine them, test them, prevent that further spread. So this friend also was infected, attended a birthday party, and then further spread the virus to these individuals. And so forth over here. These friends attended a cookout. So you can imagine that this can just keep growing as people continue to attend multiple large gatherings where masks aren't worn, social distancing is not observed, all of those things that are so important. So this just is a good graphic to show you how easily it spreads. We've had cases where it hasn't spread as easily, but there's certainly other cases where we have seen it spread throughout our community. So it's very important to as much as possible, not attend those large gatherings, follow the guidelines, social distance, and wear the mask.
Jerry?
Okay, thank you. First, Jerry Care from Lewis County Health System. First, I want to acknowledge and express my appreciation to the efforts of the Lewis County Public Health Department and the county management team. I also want to express my appreciation to the members of the broader community, the medical community, and the health system workforce in practicing mask wearing, social distancing, and hand washing. The science supports how effective those three actions are. I also appreciate the responsiveness of the governor's office and his team to our cluster in Lewis County. Less than 2 hours ago, as the details of this recent event became clear and the numbers that we are dealing with were made clearer, I picked up the phone and I made a phone call. I explained our situation, and within a half hour of that phone call, there was a commitment of several hundred Abbott quick or rapid test kits. They're on their way to Lewis County Health System, to the hospital's lab, and we are going to have the ability to support the public health efforts with rapid testing. We are right now reevaluating our COVID clinic times. As you know, we're running clinic 5 days a week, Monday through Friday, several hours a day. We have several different clinics. With the help of our facilities department, we've relocated the clinic. We've implemented some new traffic practices so we can get more people through. In addition, we're training. We started some additional training today. There are some administrative requirements when you run a COVID clinic around rapidly entering the demographic data and the results of the testing. So we're working on additional training for staff so we can support the efforts of public health and the medical community in testing anyone who needs to be tested. So there'll be some additional information forthcoming probably tomorrow with regards to the total number of tests, the test kits we will have received, and any changes in our COVID clinic. But I can say we have several hundred tests coming, and we'll clarify that once we receive the shipment. And lastly, I will just once again emphasize the message that was shared by Ryan and Ashley, and that is we have to wear the mask. We have to social distance, and we need to wash our hands frequently. If we do those things, we will continue to have the success in Lewis County that we have had since the beginning of March. Thank you.
We'll take questions.
When the governor talks about managing microclusters, would you consider Lewis County as a microcluster, or would we be talking more about a breakdown by a town or a specific zip code?
So to be clear, the cluster that we have right now of 7 positive cases likely to grow into double digits is not what the state would define as a microcluster. The positive rates in those areas are much, much higher, okay? So right now there's 3-4 microclusters, Queens, Brooklyn, the Southern Tier, and Rockland counties. The positive rate in those communities are approaching above 5%. Our positive rate has still been pretty good. So we're not on that level yet.
What I'm asking though is,
yeah.
Would it be determined as a county level, or would you be looking for that 5% in a town, or a specific town, or a zip code?
I believe,
like in the city where
yep.
they're doing it by zip codes.
I believe, and Ashley can step in here, but I believe the governor is identifying micro clusters by zip code.
Yes, zip code or area around a mile radius around, say, one particular town has many cases related to a specific event. It would be a certain mile radius around that. That's where your yellow, orange, and red zones come into play.
Okay. So the case data by town and by zip code is something that we've requested for months and months and months.
Mm-hmm.
With things turning toward this is how they're going to be determining lockdowns and things like that, will public health be sharing that data in the future when cases come up by town, by zip code, or are you going to still keep it to a by county basis?
It'll be by county, and again, we've got multiple layers of reporting now. So the school level data, and then if the county's reporting case by case, town level data, it's easier to identify specific individuals, especially in a small community. And we've seen in our community that people who have been identified as having COVID have faced some challenges within the community as far as discrimination and things like that. So it's so important to protect their confidentiality. Obviously, we need to do a good job with public health contact tracing and identifying everybody who's been exposed and quarantining those individuals. And we do our due diligence, and we make as much of the investigation as we can, and contact all of those people. And if we need to do those press releases, we do, to get further public exposures. But as far as identifying case by case by town, we will not be doing that.
So just to clarify, there's been, as of today, 7 positive cases this week since Monday?
7 positive cases in the last 24 hours.
Yep.
Since Monday. 8. Well, I guess
One on Monday, 5
the week's apparently getting on top of me. So yes, 8 cases in the last 24 hours. Since 8. Excuse me. I'm sorry. 8 cases since Monday. 7 in the last 24 hours. 6 associated with this cluster, with an additional 9 people that are symptomatic from the cluster that we're waiting results from.
Perfect. Yeah, it's okay. I don't know what day it is either.
How many more people were exposed at the church? Or is it just that the symptomatic that you have in that number? Or was there like 100 people at the gathering and these 15 are?
So we have 72 contacts associated with the cluster. That doesn't necessarily mean that they were all at the religious gathering. But there's 72 contacts with the individuals that we have done the case investigations on thus far.
Have all 72 been tested, or just the ones showing symptoms?
Just the ones showing symptoms. Again, we do a 14-day quarantine. But typically, the majority of individuals will turn positive between day 7 and day 10. So there's a slow increase in the percentage of your likelihood to turn positive, and then a slow decrease on the end of the quarantine period. But we do the full 14 days because that is the incubation period that it could take up to turn positive.
Are any in hospitalization?
We do have one hospitalized right now.
So between Monday and Tuesday, the mandatory quarantine in Lewis County jumped from 90 to 156. I would assume that may be related to the church. How are you guys ready? This is the largest jump you've seen in quarantines. Are you guys ready to do this contact tracing? Do you have manpower to do it? I mean, are you overwhelmed? How is this going for
So we've been scaling up and scaling down throughout this entire pandemic, dealing with rises in cases and falls. So we are prepared to do the contact tracing and the quarantining as well as the monitoring. We rely on our other community partners, other departments within the county to assist us with that. But we have a good core group of individuals that have been trained to help us respond.
Given that many of these individuals, it sounds like you're identifying this as like a small cluster or whatever. Are there any actions being taken for businesses in that general vicinity or anything like that? Have they been given recommendations?
They have the general recommendations in regard to social distancing, wearing masks, limiting capacity, just general recommendations for everybody to take.
Nothing as far as like requiring the school district in that area to close or
No.
businesses to close or anything like that
No.
at this point?
No.
What would trigger something like that? What kind of, are you looking at the 5% positivity rate by zip code or by county would trigger something like that?
It could be by zip code. That would be a decision that we as the local health department would make with the school based on specifically the individuals who are impacted by this. Do they have children in school? Are they children in school? So it would be a conversation between the local health department and the specific school district.
So, I mean, over the past, it seems like this weekend, there's just every county, not even in the North Country, there's been upticks kind of everywhere. And just before this press conference, we got something from St. Lawrence County that there was a gathering there at a church where there was an exposure. It's fall time, there's been exposures at farms. Are you guys thinking about taking any actions in terms of these gatherings that have been happening and the exposure? I mean, not to go as far as, let's say, we were in March, but have you been thinking about, canceling things or shutting things down at all?
So anything within the orbit of government, we've taken the necessary steps. Any events that we've had, any community events that are under our control, we've obviously stepped up to limit those. The reason why it's important that we are consistently communicating with the public is because we simply don't have the resources in Lewis County or the North Country to control every church, every business, every household, every baptism, every wedding. We can't possibly do that. This only works when everybody buys in together. And so I guess really what we're asking the public to do is to buy into the idea that masks work, buy into the idea that social distancing is important, buy into the idea that if you go into a place that isn't being respectful of the rules that are in place to keep us all safe right now, then maybe that's not a place that you want to be. And so I think that's where it needs to start. If there's places that become egregious in their violation of the state rules, we have taken action. We work through the county attorney's office and through the state attorney general's office to take action when necessary. But luckily, Lewis County has not, we haven't had a lot of egregious violations. I think the violations that we have are not malicious, but rather probably a little bit aloof to the consequences. And maybe we have a feeling that we're rural and we're isolated and it can't happen here, and the fact is that it can.
And I guess a question for the three of you in a more general sense, being local leaders, in Lewis County, how has this, I guess Uptick, this little micro burst, whatever you want to call it, what has your reaction been to that? I mean, when you first found out about it, and having the biggest single jump in one day of COVID cases.
Well, go ahead, Ashley, sorry.
Okay. So it's certainly eye-opening. It's something we're always prepared for, but it's kind of okay, here we go. We put all the wheels in motion at Public Health to like I said, fully scale up. We pull in the people that we need to help us, and we just make plans for if this is going to be long-term, making sure that we're continuing to respond appropriately. But honestly, it's something that's not necessarily a surprise, just something we are constantly preparing for.
Is contact tracing with this event continuing, and would you expect any more exposure alerts to come out of this cluster?
Contact tracing is occurring as we speak, and honestly, it all depends on where individuals have been. So,
right.
I
guess the question
say.
was more: have you already completed contact tracing on these individuals, or is it still in the process? So, we might see more exposure alerts from this event? Or?
You may.
Okay.
Possibility, yep.
And in terms of contact tracing, I think a lot of people hear that word and they don't necessarily understand what it entails. Can you kind of talk about, what you guys have to do and how much hard work you guys at Public Health, put in to do that?
So we have, for every positive case, we call that case, we do a thorough case investigation in regard to their demographic information, where they've been within the last 14 days, and that's to kind of gauge, okay, where maybe did you contract the virus, and then also specifically the last 48 hours prior to the start of their symptoms, or 48 hours prior to the positive test. If they're asymptomatic, meaning they don't have symptoms, who have you been in contact with and where have you been? And jotting down every detail. So a lot of times we'll get an initial list of individuals and we'll tell them, keep thinking about this, call us back, we'll call you back. So we really track their every step for those 48 hours prior. We gather that information, gather contact information for individuals identified. If we don't know if it's a public exposure and they don't know who was there, we'll put out a press release to say, you may have been exposed at such and such location at such and such time. Those individuals would call us and we would quarantine them. So it's calling all of those contacts, quarantining them for the 14 days, educating them, arranging for testing, and then we also monitor them for those 14 days to make sure that they do not develop symptoms.
So how daunting is that task? Now we're talking about upwards of 15 people. You're having that could turn into hundreds of people. How daunting is that task for you guys at Public Health?
It's certainly a major feat, and it requires a lot of manpower, but we're scaling up and using all that we have. But at this point, it's manageable. We can do it. I've got a great team at Public Health. They've worked extremely hard, and we're prepared.
In many of our early cases, it seemed like a lot of those cases were asymptomatic. Is this kind of the largest number of symptomatic cases that you've seen in the county since the pandemic began?
I would say not. I would say very early we had mostly symptomatic because we were only testing symptomatic. I would say more mid-pandemic we saw some more asymptomatic individuals. And I would say recently that, we've had symptomatic individuals throughout, but a cluster of symptomatic individuals I would identify this as, yep.
And speaking of demographics, can you give any information as far as when you look at the 78 total cases in the county, are you noticing a pattern? Is it a mixture of people? Is it mostly younger people, mostly older people, or just kind of?
It's really a mixture, more, I would say, younger to middle-aged is, a higher number, but, we've had elderly and we've had some children, so.
And Jerry, when you mentioned the testing kits from the state, I'm trying to think of when you last brought it up. I think it might have been at the October meeting of the Board of Legislators. You talked about the state sending you some kits for to help with the schools and things like that, that you were going to be implementing those. And I think we heard a few days later that had stopped or something. Did the hospital already receive those kits prior to that, and have you been using the rapid test to assist with the schools?
Yeah, we've been using the rapid test to assist testing faculty and staff at the schools, but not students. Ashley and I have put in a joint request for inventory so that we would be able to rapid test any student who presented to sick protocol. We would be able to rapid test. So we are cautiously optimistic that will happen. But to address your earlier question, this didn't have to happen, okay? And I think, Ryan's remarks really reflect that. We have been blessed in Lewis County. No one has died from COVID. No one. But across the country, across New York State, and across a number of our communities, not far from here, people have died. And so Ryan spoke of COVID fatigue. Absolutely, we all get it, we all understand it, we're all sort of like over this at this point. But the fact is, we can't be over it, because our risk right now is a combination of COVID fatigue with complacency. And this is complacency that has occurred, okay? And eventually, COVID fatigue plus complacency will equal death in Lewis County. That's not an exaggeration. That is a reality. We have been fortunate. We have not lost anyone to COVID-19. And I think it's because of the work of public health. It's because of the work of the county. The hospital's role is to support those efforts, and when appropriate, have that medical infrastructure in place so we can test. I think the state has been very responsive to our request for rapid tests. And as I reflected earlier, but we're not the only community or county needing these test kits. The stress on the supply chain nationally is phenomenal. Every single day, our lab director is working on bringing more test kits here. There is a light at the end of the tunnel for test kits, and I do think with this inventory that we're expecting either later today or tomorrow, coupled with what we've requested, I think we can be very proactive in testing even more people, so that if there is an infection, we can very quickly get our arms around it, or an exposure, we can very quickly get our arms around it to limit how many contacts there are. Because if you can do that, you can keep COVID at bay and keep our community safe. So it's real. We're fortunate people have not died, but we cannot become complacent.
The last time we asked, there hadn't been any positive cases that you got through the free asymptomatic testing clinic through the hospital. Is that still the case?
No, I mean, the clinic is, the results of the clinic, when there are positives, get reported to public health, so contact tracing, and we have had positive, both asymptomatic and symptomatic cases come through the clinic. And we've also had positives that have shown or presented at the emergency department, and in one instance recently resulting in an admission to medical surgical.
Okay. And can you, oh, I forgot what my question was. Basically, can you just update people on what the visitation status is at the nursing home and hospital? Is it where it was the last time we spoke, where you're doing the visitations in the gift shop for the By floor?
So at the hospital, it hasn't changed. It's a defined period, I believe, 3 to 7
Yeah.
in the afternoon. And there's a process for all of that to work, and the number of visitors are limited. For the nursing home, we continue to do the visits through glass, and we receive really good feedback from families. And over the last week, we've been able to reinstitute in-person visits. And so Deb and her team have done a great job. Our challenge now is there are some guidelines on individuals going through testing and being able to verify they're positive. So there have been a few hiccups there, but by and large, with running clinic 5 days a week, and the state-sponsored clinic has been very helpful in helping people meet that requirement. Now, this outbreak or this cluster concerns me because all we need is one employee to test positive at the nursing home, and then visitations are shut down. I have no idea how many of our staff are related to this situation, but if one of our nursing home employees tests positive, then we have to shut it down again.
You guys are still testing once a week?
Oh, yes, yeah.
Okay.
We are
For
testing
all
once a week.
employees. Okay. A question for Ryan that has been coming up. A few people have called in and messaged in lately with just kind of wondering, is the county thinking of any kind of plan or strategy with Lewis County's well-known snowmobile tourist destination in the wintertime? Is there any plans in place for how you proceed with snowmobile season this year?
Yeah, that's a great question. It's an extremely relevant question, and if there's one thing we know in Lewis County, the snow is going to be here before we can believe it. So yes, there are plans to make plans. We've got a task force that I'm putting together that actually began this week. We've talked about setting some money aside for businesses as a grant program to help them build out their outdoor space before the winter comes. So adding picnic tables, adding propane heaters, adding fire pits. It's going to create a lot of tension for us at the county trying to do our jobs, and these businesses who are very seasonal. Some of them barely get by as it is, and the demand this year for outdoor activities is going to be through the roof. And so it's going to be very difficult for us to have to go toe-to-toe with these businesses and tell them to reduce the number of people in there and kind of enforce those things. So it would be great to try to get out ahead of that, try to provide some incentives for people to build out some outdoor space. We have some brutal winter days in Lewis County, but we have a lot of nice winter days in Lewis County. And on those days, if there are some more picnic tables and some more outdoor heaters and some fire pits, those businesses can still take advantage of the tourism without putting the community at risk. So those are the types of things that we're going to have to look into, and we need to get moving on that immediately. So we do have a group that's been put together to start working on that, and we hope to have some announcements soon.
And then I just wanted to get your reaction. They kind of talked about it a little bit. What is your reaction to this microcluster, and could this be, I don't want to say it, but the start of a potential second wave?
My reaction is this. First, I think of our public health staff who have been working tirelessly, have been working endless hours. It's unfortunate to me when we have events like this that take place where people blatantly disregard the safety measures that have been put into place. And that means that our folks, and don't get me wrong, it's their job and they love their job, but we've been at this for 8 months, and it's difficult to contact trace 72 people. It's not easy. And so I don't think this is a huge reflection of community safety. It's still only 7 cases. Maybe it'll, balloon to 15 cases. But it's a lot of work, and it's an indication that some folks in the community, aren't as concerned with, some of these guidelines as perhaps they should be, and we all should be. I'm not going to stand here and be, holier than anyone. we all have to take this more seriously. And I think maybe more than anything, it's a wake-up call that this winter is going to be tough, and this virus is certainly not over. And as a community, we certainly need to buckle down and continue to take it seriously.
So at this gathering, I don't know if you guys know this information, was social distancing being practiced? Were people wearing masks? Or was that?
We know that some people were observing, some people were not. And we do know that there were folks who had traveled in from multiple states. So, you know, if we want to be isolated and we want to say that we're, you know, separate and safe from everybody else, then that travel restriction is an important element to that. So.
Does Lewis County still have the, I know the state has their own travel arrangements, but I think there was a time at the beginning of the pandemic where it was recommended from people from downstate and New Jersey and those areas not come up?
Not yet. We haven't put that forward like we did last spring. Perhaps something to consider. The fact of the matter is, New Jersey, Connecticut, and New York City are not the problem right now.
Right.
So we don't need to go beyond what the state has put into place, because those places are doing okay.
Okay. And just from the hospital's perspective, Mr. Kerr, I just wanted to get your kind of what you think about when everything first started in March, and you know we were doing the press conferences regularly, and we heard about slow the spread and help stop the spread, and a lot of it was concerned out of overwhelming hospital capacity and things like that. What is your feeling now that we've had 8 months? You know, obviously a lot's been learned over that time. Are you more comfortable seeing a cluster like this now as opposed to in March? And stopping the spread and things are so important, but kind of what's the hospital's position now? Are you still worried about capacity issues if outbreaks happen?
Yes, I would be, because right now we have something else that's out there, and that's called the flu. So you've heard recently about twin spikes, the flu and COVID. I think that's real, and our medical surgical census has been at capacity now for a number of days. Back in March when this all began, the hospital for a period of time was like a ghost town. No one came. So from a capacity perspective, we were better positioned for this type of event then. It would be more challenging for us now if several of these positives end up needing hospitalization.
Yeah.
So I think, we've been evaluated several times by the Department of Health and the Joint Commission regarding our implementation of all of the guidance, and the team has done a great job. Everyone from the nurses, the technicians, the physicians, the environmental services staff, were high marks for everyone on that. But I come back to what we're talking about didn't need to happen. And if we take the measures that Ryan has reflected on and Ashley has reflected on, we can continue to be a resource that becomes available for our community without overwhelming any of it. So, we just got to practice mask wearing, social distancing, and hand washing, and we will be well positioned to deal with anything that comes at us.
One final.
And get your flu shot.
And get your flu shot. One final thing. We'll wrap up. What we're talking about here are small sacrifices. Limiting gathering capacity is a small sacrifice. Wearing a mask is a small sacrifice. If we fail at the small sacrifices, then we have to make the big sacrifices. That means schools closing. That means businesses closing. That means people's livelihoods being put at risk. So I guess if there's a message, it would be make the small sacrifices so that our whole community doesn't have to face the consequences of bigger sacrifices. And I think that'll wrap it up for today. So thanks for coming, guys.